I think we're live. Oh, I forgot to turn off the chat.
Good to go, Clara.
All right, thanks for your patience, everyone. We are here and we are ready to go. Greetings, I'm Clara Hughes, six-time Olympic medalist, and I'll be your moderator this evening. Welcome to the second This Is Our Shot live town hall for vaccination awareness. Before we begin, I'd like to acknowledge that I'm on Treaty 7 territory, the ancestral homelands of Blackfoot, Stoney Nakoda, and Tsuut'ina peoples. My pronouns are she, her, hers. 3 weeks ago, we held our first town hall, and how far we've come since then. Did you know that as of today, 19.5 million Canadians have received their first vaccination dose? Did you know that because of vaccinations, the third wave was not as deadly as it could have been? There were a significant rise in cases and hospitalizations, but not a corresponding increase in deaths. Did you know that because of vaccinations, those living in long-term care are now protected? Yes, we have so much to celebrate, but we still have such a long way to go. People have questions, they have concerns as new information comes in daily. We're fortunate to have 8 fantastic doctors here with us tonight to provide clear information. They're medical professionals who care and who we trust. Without further delay, let's meet our panel. Doctors?
Good evening, everyone. My name is Eliana Castillo. I am an adult internist and a reproductive infectious diseases doctor, and I work out of Calgary.
Hello, everyone. I'm Cora Constantinescu. I'm a pediatrician and an infectious disease specialist in Calgary, and nationally, I work with 19-0 Coalition.
Hi, everyone. I'm Kwadwo Karamantang. I'm an ICU and palliative care physician in Ottawa and also the host of the podcast Solving Healthcare.
Bonsoir tout le monde. Mon nom est Dr. Franz Daniel Lafortune. Je suis un omnipraticien basé à Montréal et je fais surtout de la médecine d'urgence. Good evening, everyone. My name is Dr. Lafortune. I'm a GP. Working mostly in emergency medicine, and I'm also a board member of the Black Physician of Canada.
Hi there, my name is Menaka Pai. I'm a hematologist and a blood clot doctor at McMaster University in Hamilton.
What's going on, everybody? It's Dashminder Singh Sadeh. I'm a trauma and emergency physician out of McMaster, and I'm also coming to you live from the Hammer.
Good evening, everyone. I'm Dr. Esther Tailfeathers. I'm from the Kainai Nation. I'm coming to you from the middle of the Blackfoot Confederacy, or Treaty 7 territory, as Clara had introduced.
Hi, everybody. I'm Haley Wickenheiser. You probably remember or know me from the ICE. You may or may not know, I just finished medical school and I'm a newly minted resident physician coming to you from Toronto via Calgary. It's nice to be with you all tonight.
Thanks, doctors. I'd also like to acknowledge that today is Family Doctors Day in BC, and thank you to all family doctors for your kindness, caring, and service. Before we get into it, we have a special video to kick off tonight's Hour of Information Power. Last town hall, we were fortunate to receive a powerful message from Tyler White, the CEO of Sixica Health. Tonight, our opening video comes from Tawani Joseph, CEO of the Tawani Group, who is also the CEO and Executive Director of the 4 host First Nations for the Vancouver 2010 Paralympic and Olympic Winter Games. Tawani knows about the power of community and working together. Let's hear what he has to say. We may have some problems with the video, and if we do, I'm just going to give the main message that Tawani offered to us, and it is a Squamish term that is Chen Chen Tsui, and this means holding you up and supporting one another. Tawani talked about community, about coming together, protecting one another. And the Squamish Nation is a place that I know well and dearly in my heart. So Tawani, although your video is not here with us, we know that you are, and we're grateful for that beautiful concept for us all to root into. So, doctors, are you ready? I think we should get into this finally. We have a lot of questions to go over. Dr. Pai, we're going to start with you. This question is, I'm concerned how quickly the vaccines were developed. Does the amount of time it takes to develop a vaccine impact its efficacy?
That's a great question. So normally vaccines take about 5 to 10 years to be approved, but the delays usually don't have anything to do with the actual science. So usually scientists have to look for money to support their work at each phase of vaccine development, or they have to invent entirely new technologies for their vaccines. So this time around, our scientists had sufficient government funding so they could really just focus on doing great science, and they could build on a vaccine technology that already existed. So people should know that none of the COVID-19 vaccines approved in Canada took a single shortcut for any of the safety steps, and we continue to monitor their safety and effectiveness in real time.
Excellent. Thank you, Dr. Pai. Dr. Sedev, would it be better to have most Canadians get their first shot or have the high-risk population become fully protected with 2 shots before proceeding to give shots to others?
This is a great thing to scratch your head about. But let's just establish what it means to be high risk, first of all. So when we say high risk, what we really mean is people who are at more risk of dying or having a bad outcome because of COVID. And when we say this, we mean people who are elderly, who have a high risk of death, people who are living in First Nations zones that have far disproportionate consequences to a pandemic sweeping through their environment than the average Canadian. Congregate settings, so here we're talking about retirement facilities, actually nursing homes, long-term care facilities, even other institutions like detention, for example, and then frontline healthcare workers. This is what we mean, people who are going to have worse consequences than other people. What we found is that when you get your prime dose alone, it actually offers 80 to 90% protection to COVID. And it actually lasts many, many months. So when we say protection, what do we mean here? What we mean is resistance, not really from the illness itself, but resistance to hospitalization and death. So we've got excellent results. 80 to 90%. What does the booster do? The booster is more of a fortifying effect. It doesn't really extend your probability of not getting sick, but it improves your body's memory with those antibodies. So really the best thing that we want to do in a scenario when there's limited supply is do whatever we have to do to get the most people in a spot where they're not going to be hospitalized. So hitting as many people as possible with that first dose. And that's exactly what we did. So now we're in a different spot. We've got better supply, and we can think about this complicated decision of who does the second dose go to? Does it go to high-risk people? Do we continue with this first dose rollout and just carpet the nation with primes? And in Canada, we're fortunate enough to actually do both simultaneously. And that's exactly what we're doing, because right now we do have sufficient supply.
All right, thank you. Dr. Karamantan, could the delay of 4 months between the 2 shots render the mass immunization ineffective?
Yeah, thanks for the question. I think the great answer by Dashminder really kind of illustrated the value of that single dose. And forgive me if I'm mistaking which vaccine it was, but there's some significant data showing the further you are out, the more you're actually protected. And so this is really encouraging. And I commend the courage that the Canadians we took to vaccinate as many of us with that first dose as possible. And the key thing, as Dashminder was mentioning, is like you'll see this different numbers when it comes to the efficacy is a term you'll see used when it comes to vaccinations. You'll see that 80%, you'll see the 68% AstraZeneca, what have you. But when it comes to hospitalizations and death, it's unbelievable. So when we look at 130,000 patients or people that were in those trials, literally one person was hospitalized. That's the kind of effectiveness that we're talking about. And so, and once again, that single dose also has significant protection when it comes to hospitalization. So I hope that answers the question, but I think it's real positive the way Canadians have approached our vaccination rollout.
Excellent, thank you. Dr. LaFortune, will the vaccines protect against variants, or will we need boosters?
Thank you very much for the question, Clara. So definitely the answer is yes. All the different vaccines are proved to cover the variants that we know of. So the UK variant, Brazil, South African, and even recent data that just came out a few days ago are telling us that even the Indian variant is covered. So that's great news for every one of us. And one of the proof that this is working is the example of my province in Quebec. 80% of the case in our province are from variants. And with the vaccination going through and through, we still see a significant decrease of the incidence of the new cases. So definitely a good proof that we are covering all the variants. The second part of the question is, will we need boosters? So only time will tell us. And Dr. Sedev already started giving us a good answer of that. For sure, we're watching two things. First and foremost, if there's new variants that will become and maybe not covered by our actual vaccine, maybe we'll need a booster on that level, because there's so much mutation for that COVID virus. The second thing is, just like Sedev said, if we need to improve our body memory, right? Because there's for sure an initial immune response that could be weakened, and that we will need another booster, just like for our tetanus that we need to boost every 10 years. So definitely that's something that came up. So great news, coverage from all the variants, and the booster. It's also great news because we have already experience with seasonal flu vaccine and with tetanus shot. So, en français, juste pour continuer, donc la question était vraiment, est-ce que les vaccins nous protègent contre les variants et aurons-nous besoin ensuite d'un rappel vaccinal? Donc, l'excellente nouvelle est que oui, les vaccins actuels que nous avons nous protègent contre les variants. Et par les variants, on parle de ceux de Grande-Bretagne, du Brésil, d'Afrique du Sud, et aussi les données récentes nous permettent de dire que le variant indien qui frappe énormément ces temps-ci est aussi couvert. L'exemple que l'on peut prendre justement au Québec, 80% des cas que nous avons présentement sont dus à des variants, et avec la vaccination qui va très bien, on voit une différence, une diminution significative de l'incidence des nouveaux cas. Donc, ça nous prouve hors de tout doute qu'il y a vraiment une couverture au niveau des variants. Est-ce qu'on aura besoin de rappel vaccinal? La réponse, c'est le temps nous le dira. Deux choses qu'on doit vraiment regarder. Premièrement, est-ce qu'il y aura des nouveaux variants, donc des nouvelles mutations qui ne seront pas encore couvertes par les vaccins? Et la deuxième des choses, c'est est-ce qu'on aura besoin d'un rappel pour avoir une meilleure réponse immunitaire, un peu comme dans le cas du tétanos ou dans le cas de la grippe saisonnière. Donc, deux bonnes nouvelles, couverture au niveau des variants et possiblement un rappel, mais on a déjà l'expérience du tétanos et de la grippe. Voilà.
Okay, merci. Dr. Karamantan, this is a long one, so pay attention. I understand that all of the approved vaccines here in Canada offer varied levels of protection from contracting COVID-19, but also greatly reduce the chance of developing severe illness or death if one does contract COVID-19 after being vaccinated. What I'm wondering is, if someone gets vaccinated and then contracts COVID-19 and only develops mild illness, can they still sustain damage to various organs or have that long haul symptom similar to many unvaccinated people who have had asymptomatic or mild cases of COVID-19 and suffer from those types of afflictions?
Yeah, that's a great question. And I think the short answer is, I think it's highly unlikely that if you have a mild version of the disease that you're going to have extensive long haul symptoms. You know, like I think when we see some of like when I see patients come out of the intensive care unit, unfortunately, like they have some significant like impacts. Their lung function is impaired, their strength is impaired. You know, so I think what I would the short version of that answer is the protection is significant. And so, I always say control what you can control. I mean, if you do have an exposure, you seem to be one of the unlucky ones that contract COVID after getting vaccinated, knowing that you're less likely to be hospitalized, you're less likely to have severe disease. And I would say you would, in my humble opinion, you're less likely to have long haul symptoms or syndrome. I think most of us would agree with that. But once again, the key thing though is regardless, get vaccinated and give yourself the best form of protection.
Great message. Thank you. Dr. Cora, I'm worried about my kids getting a vaccine. What will be the long-term side effects?
I think that's very natural for parents to worry about long-term effects in their kids. So it's a very natural question. I'm a pediatrician and a mom, so I hear where that's coming from. Here's what we know. We know that most reactions, if one has to have a reaction from a vaccine, happens within 6 weeks from previous vaccines. We expect it's the same for the COVID-19 vaccine. We've now had adults being looked at for months, and we have not seen any effects that start past that 6-week mark. So we don't have any evidence to really say that the COVID-19 for kids is going to cause long-term problems. Whenever they've looked at that in other vaccines, they haven't seen that. But you know what we do know now? We know that if you have COVID, the disease, you can have long COVID or post-COVID syndrome. And now they're starting to realize that in kids as well. And what's really fascinating is just a couple of days ago, when they did a survey on that long COVID of people who got vaccinated, their symptoms improved after the vaccine. So that's not a clear causation, but correlation and hope. And again, to show that we have support for why we want to immunize them and not really any evidence to make us concerned about long-term effects.
Okay, excellent. This is another question for you, Dr. Cora. I am under 18 and want to get a vaccine, but my parents are against it. What do I do?
You can go ahead and have it because in Canada, we respect the rights of teenagers. We call them mature minors. And it means that we respect that they have the right to make their own decisions about their own health. All my teenage patients can tell you that I often kick their parents out of the room during an appointment because it's important for teens to take control of their own health. So when it comes to the COVID-19 vaccine, if we deem that the teen has capacity to consent, then the parent's consent is not needed.
Okay, thank you. Very clear. Thank you. Dr. Karaman-Tang, I'm coming at you again. I know people who have ended up in the ICU after the vaccine. Is this because of the vaccine?
Very good question. And in my humble opinion, I have not seen any clear reason to think it would be because of a vaccine. In fact, the cases that I'm aware of are they've been vaccinated so close to when they contract COVID. So often the cases I've seen has been within a realm of about 2 weeks from when they got their vaccine. So we're not seeing the peak effects of their vaccines, and it's usually after a single dose. And so with that story, it always seems like they've contracted COVID just after they're vaccinated or just around that time. And so I personally have seen no clear evidence that the vaccine would cause any negative impacts on one that would land you in the intensive care unit. And I just think it's related to the timing more so than the effectiveness of the vaccine.
Okay, thank you. Dr. Tailfeathers, this one's for you. I have a history of getting the flu and or the cold every year despite getting the flu vaccine. What's the point of getting the COVID vaccine for me?
Well, to remember that COVID is much more dangerous than most of the flus that we have, and we've seen the impact across the country. In my community, we have seen many deaths and very few deaths from flu. So we know it's very dangerous, and we see a lot of long haulers or people that get very sick and have months and months of rehabilitation. So it's important to remember that you need to protect yourself against severe disease or death, and also that you are protecting the ones around you if you get vaccinated. So you're breaking the chain. So what we need to do is we need to break the spread.
Okay, thank you, Dr. Tailfeathers. And Dr. Cora, in general, how do people talk to family and friends who are hesitant? I think we all struggle with this. How do you open up this conversation?
Thank you for that question, because my big ask of every one of you is to become a vaccine champion. And here are a few things you can use when you talk to your family and friends. First of all, you need to connect with whoever it is you're talking about this. So that sometimes means that you can share your own story, because it builds a bit of common ground and they understand where you're coming from. And then you have to meet them where they're at. Not where you'd like them to be, but where they truly are at. So that means that you have to be truly curious about what is behind that reluctance to vaccinate, and also get them to reflect on what the pandemic has meant to them and their family. And then when you frame your vaccine message, around those benefits to them, because you can do that because now you've learned a bit more where they come from and also what this pandemic has meant to them. So personalize the message, stay away from any debates on philosophy, just keep it about them and about how this is going to make a change in their lives.
Thank you. I'm really excited to say, Dr. Wickenheiser, Haley, you're a teammate of mine, not just in the winter sports, but in the summer sport as well. We went to 4 Olympic Games together as teammates in different sports. And now, Dr. Wickenheiser, I have a question for you. What does herd immunity mean? What percentage of the population needs to be vaccinated to get herd immunity?
Well, thanks, Clara. Definitely don't call me doctor, just call me Haley. But herd immunity is essentially population or community immunity. And what that means in this scenario with COVID is essentially the more people that we can get vaccinated, the more protection we have for the entire population. So, for example, measles and polio, 2 diseases that are essentially eradicated from life as we know it today. I know we have some cases of measles that pop up here and there. We know that to eradicate those diseases, with measles, it was about a 95% that we need of the population to have the vaccination for measles. And polio is about 80%. And so with COVID, the estimations now is that we need at least 70% of the population or more, that could change, vaccinated to be able to actually get herd immunity or population immunity, which means that the population in general is protected.
Okay, thank you. Dr. Pai, can you explain what the risk of a blood clot with AstraZeneca is after the first shot?
Thank you for that question, Clara. This is on a lot of people's minds. I know it's raised a lot of worry for people who receive the AstraZeneca shot. What we can tell you is that the numbers are constantly changing because we are finding new cases and we're giving more shots, which is always a good thing. Right now in Canada, we think that the risk is about 1 in 50,000 shots given of the AstraZeneca vaccine.
Okay, and this is also for you, Dr. Pai, to follow up. Is the risk of blood clot the same with the second AstraZeneca shot?
Yeah, another important question, because that's on people's minds. They're thinking about their second shot. So the best data that we have comes out of the United Kingdom, where they are still giving the AstraZeneca vaccine. And we think that the risk is somewhere around 1 in a million, but we're constantly collecting safety data.
Okay, thank you so much. As someone who received the AstraZeneca, I'm really grateful for all of your information. Dr. Kyeremanteng, again, I had my vaccine. Can we have vaccinated friends or family in our homes? When will this happen? This one's on everyone's minds, I think.
This is a bit of a contentious one and a great question, though. And there's a lot of places around the world approaching this differently. And I think the main thing is, 1, are you fully vaccinated? 2, what is your personal risk? You know what I mean? Like if you are somebody that has poor lung function, you have poor immune system, that'll affect your decision to when you want to gather. 3, how much COVID is out in the community. So there's a lot of factors, I think, that weigh into this question on when we could gather safely. I do think I'm just gonna give my personal opinion. I think once you got two people that are vaccinated, you know, that are fully vaccinated, your risk of contracting COVID will be low. But I think depending on the factors I've mentioned, that also comes into play. So this is where I'm really just seeking the opinion of public health when they feel like we are at a stage where we can gather indoors again. And what I would say as well is I would also push our public health and governments to say, give us that roadmap, give us that really that roadmap of when things will be safe, when we could have these goals. Because actually, I do think that will help with vaccine hesitancy, where people see that there's clear direction. Once we get to 75% first dose, you know, we can have indoor gathering or what have you, to have those kind of goals that are available to the public. Wow, that just really provides that incentive for us to get those needles in our arms. So sorry, I'm not answering that directly, but I do think the public health, our public health organizations will be very helpful in terms of when we can, but we will get there. We have to get there.
Yeah, very good point, especially at the end. We will get there. And I know as an athlete, the idea of an unknown race with an unknown finish line would be the ultimate torture. So it is so important to let people know this is what we can look forward to. So thanks for that message. Dr. Pai, can fully vaccinated people transmit COVID to one another?
Yeah, that's really similar to the last question because it's something that's on our mind. So here's what we know from real world studies in countries with really high rates of vaccination like Israel. We think that when everyone's fully vaccinated, that there is less of a risk of transmission. But what I can tell you is that it's not 100%. So just as my colleagues are saying, I mean, let's wait for direction from public health. If you're fully vaccinated, that's great for you. It's great for your community. But right now, until we get that really important roadmap, it's important that we keep following public health regulations. But I'm super optimistic about it, Clara.
Okay, thanks, Dr. Pai. Dr. Sedev, on the site, and I think that they're referencing that this is our shot site, it says it takes 1 to 2 weeks after the second dose for the body to build immunity after vaccination. My question is, what immunity or protection do we have after the first dose?
All right, so let's pull this back to the question I answered previously. What does protection actually mean? So in this context, when we say protection, what we're saying is protection against hospitalization and death due to COVID. And when we come up with these percentages, you know, something is 90% effective or 95, whatever it is, what we're talking about, this percentage, it applies across a group of people. So your own individual risk could be higher, could be lower, but this is what it comes to across a population or a specific group of people. So how much immunity do you have? What are your chances of getting sick? A single dose is pretty damn effective. It's really effective. So a couple of large studies. So earlier on this spring, Lancet published, I think it was first dose Pfizer, showing at least, I think it was 70% effective after about 3 weeks. Similarly, also in the UK, I think this was Scotland, way bigger, over 1 million people, 90% effective after 4 weeks. So 90% effective in protecting against hospitalization and death. That's tremendous after a single dose. So numbers for other vaccines, AstraZeneca, for example, pretty similar, about 88 to 90%. So very close. So bottom line here, you do have tremendous protection after one single dose. Hence, also providing justification for the strategy that we used in Canada of rolling out that first dose for as many people as possible. More recently, some of my colleagues that are much smarter than I am made me aware of meta-analyses. So a meta-analysis is a study of various studies pulled together, and these meta-analyses are reporting even greater effectiveness. So 95 to up to 99% effective at preventing death and hospitalization due to COVID after one single dose of vaccine. So bringing it back again, your prime. Your first dose really is where you're going to get your protection from. That second dose, it's not a top-up. It's a fortification. for your body's immune system to help remember what it has to do when it's encountering this virus again.
Excellent. Dr. LaFortune, what happens if I don't get my second shot? Do I need this shot?
Definitely, and I think that Dr. Sedef said it extremely well. You know, you will have for sure a partial immunity, and we're all aiming for a complete, or as far as we can go now with our science. So definitely it is better than nothing, but we definitely encourage everyone to get both of their shots. And all the studies from the industrial company that have built these vaccines were made for 2 shots. So I think it is just extremely secure and prudent from us to follow the guidelines from this thing. Do I need this? Do you need this? We all need this for sure. And like we already spoke, Ailey spoke about it, the community immunity that we're aiming. And also we need to get in touch with the fact that probably there's going to be a vaccine passport. So if you want to go back to a normal life, you want to go back to traveling, some jurisdiction will maybe ask for us to have a proof of 2 shots of a vaccine. So definitely, collectively and individually, we all need this.
Okay, thank you very much. Dr. Castillo, hi there. I'm currently on birth control. Is it okay to take the Pfizer vaccine and birth control pill at the same time?
Great question. So yes, it is okay. And it is a good idea. So the reason I say that it is okay is that data that, from the clinical trials that the pharmaceutical companies did, and data, from now the millions of people that have had the Pfizer vaccine has not found an increased risk of blood clots with the Pfizer vaccine. So that's number one. It is a very good idea because if I get COVID infection, and especially that COVID infection is bad enough that I have to go to the hospital, then the chances of actually having a blood clot is higher. So, birth control pills can also slightly increase the risk of blood clots. So getting COVID-19 and being on the birth control pill are 2 risk factors for blood clots, whereas getting the Pfizer vaccine actually will basically take away my risk of getting COVID-19 infection. So.
Excellent. Thank you, Dr. Castillo. Dr. Tailfeathers, who should get that 1-shot Johnson & Johnson vaccine? Not sure if we lost Dr. Tailfeathers.
Sorry, I had my mute on.
Okay.
Yeah. So for those who don't want to, are afraid of having injection, one is fine, and also for those who have to travel a long way to get their vaccination and travel across districts, it's probably best to be safe at home. So one is much easier than having to travel twice for 2 shots. And the third thing is that many people don't want to be inconvenienced by 2 injections. They want the convenience of 1. So Johnson & Johnson is very good for those individuals who have those issues. Thank you.
Excellent. Thank you, Dr. Tailfeathers. I actually have a friend down in Utah who got the 1-shot Johnson & Johnson, and he was so stoked. He's like, I only had to get 1. So, and that obviously it's different than in the United States. They do have a vaccine surplus and many options, but he took that one and he was happy with it. Dr. Castillo, this is another one for you. What evidence is there regarding the vaccines and the effect on menstruation cycles and the ability to get pregnant?
Wow. There is, so number one, when I hear all the anecdotes and all the noise that is going on the press and on social media about, menstrual cycles and fertility, the one thing that comes to my mind is how hard this pandemic has been on all of us, and when we are worried and when we are fearful, how we start worrying about things that are so intimate, and personal, like, my periods or, my ability to start a family. But anyway, getting to the data. So there are anecdotes, and by anecdotes, I mean people that have shared their experience that after getting the vaccine, they have missed a period, they have had spotting after getting the shot, or that they have had a heavier period. But also there are anecdotes about those things happening when people have had COVID-19 infection. And that kind of makes sense because when we are under the weather, or when we have, a serious, illness happening with us, but also when our mood is low and when we are very stressed out, then that can influence, the hormones that regulate our periods, etc. An important thing is that this particular question needs to be scientifically studied, and this question was not studied, in the clinical trials before the vaccines came out. The good news is that that question is being studied out now. So there is a study by the University of Illinois that has collected, that has asked thousands of patients specifically about that. And there is also a smaller study, with about 350 women who are on the, who are receiving one of the vaccines that are made in China, and that that trial is happening in Turkey, and they are specifically following that. So I guess that's for the periods. Now for fertility, that was probably one of the strongest, and I would want to say rumor, but or theory that came up in social media and in the press. Like, it was in the New York Times in December, so as the vaccines were licensed. So what we know is that actually answering that question properly takes a lot of time with science. So the data that we have up until now is real life data that has looked at people that actually already have infertility issues. So actually they go to clinics where doctors look at their eggs, or their sperm, because otherwise, it's very hard to look at eggs and count sperm. But anyway, so a lot of the data that we have is in preprint. Mostly comes from Israel and comes from fertility clinics. And they have, they have looked at people that are going, they can't have babies, and for one reason or the other. And so they were going to the fertility clinic, and they have asked those people if they had the vaccine or not. And they have compared those who had the vaccines or not. And they have seen that the vaccine does not affect the sperm count, and that the antibodies that you get after getting the vaccine do not interfere with the egg function. But those are very preliminary studies. And maybe the last thing in terms of infertility is that the rationale behind the worry on infertility is that when we get vaccinated, the antibodies that we make thanks to the vaccine are against the spike protein. And somehow people has postulated that the spike protein looks similar to some proteins that we normally have in the placenta, which is what nurtures pregnancy. So that's the rationale, that if we get vaccinated, the antibodies that will protect us from COVID-19 are going to attack the placenta. And all I can say is that people has continued to get pregnant and have babies during the pandemic, even people who have had COVID-19. So that argument doesn't hold very well.
God, it's so complex. Thanks so much for explaining the intricacies of that, Dr. Castillo. That's excellent. Dr. Tailfeathers, I have another question for you. And it's mental health related. I have severe anxiety, and I'm worried about getting a needle and being in a vaccine clinic. What can I do to help my stress levels and my anxiety levels so I can get my shot?
I think a couple of things. One is to remember that the doctors and nurses and the staff that are giving the injections are well trained, And by now, many of them have done hundreds of shots. So they're very good at what they do. And most of the clinics that I've been to, the patients say they hardly feel anything at all, if anything. And so it's very, very mild. And I would try to encourage people not to be afraid of it. Also to look at weighing the risks and benefits of one tiny needle versus many needles and a respirator, ventilator, and all of the other interventions that may happen if you get really sick with COVID. So there's a huge difference between one tiny needle and many, many needles and machines. In the clinics that I've been to, the people who have been worried have brought a family member who has been vaccinated, or they come to the same clinic with somebody else and they hold hands and comfort each other. So if you want to do that, that helps a lot. And the last thing I want to say is you don't have to drop your pants. So that's the best thing about this.
That's the best. Oh, Dr. Tailfeathers, I love that. You know, I have a good friend in Ottawa who asked me that very question, and she said to me, and I'm going to share this as a non-medical professional, but my friend shared with me that she said she asked for help when she went to the clinic. She told the nurse that she was very stressed and was dealing with anxiety, and they found her a quiet place to sit, and they looked after her, and they gave her just the feeling of calm, the feeling of that she belonged and that she was doing something important, and they got her through. So thank you to everyone that's helping out, all the people at the clinics, and thanks, Dr. Tailfeathers. That's excellent advice. Dr. Wickenheiser, do you think it will ever be safe to do outdoor sports and indoor sports again?
Yes, that's for sure it will be. Of course, we will get there. There will be sports again. Of course, I get this question almost every day, being in both fields, in sports and in medicine. So, you know, I think what I'd like to just do is just give people a little bit of perspective on sports. So right now I work at the highest level in hockey at the NHL and with the Toronto Maple Leafs. And every day that I go to the facility, I get tested both a rapid test and a PCR test. So 2 COVID tests, 2 swabs up my nose every single day. Even on an off day, all of us working in the facility must drive there to get tested. And so the measures to protect the Toronto Maple Leafs bubble are very, very high. And of course, there's a lot of money to be able to do that and all of those things. If you think about a minor hockey situation where you have kids and teams coming from all over the city, different houses, different schools coming together to congregate in the same facility like the Toronto Maple Leafs, not being tested, not having any protocols like the NHL would have, you can imagine how difficult it is. And even at the NHL level with those tests, we have still had players, staff test positive with COVID through the season. And we all saw what happened with the Vancouver Canucks, where the entire team had COVID. And so the measures and the protocols that have been put into place have been appropriate to try to protect people from transmitting, which goes like wildfire in a team situation. I remember once with the national team, we had a water bottle. I was drinking early days, drinking all out of the same water bottles without labels with your names on it. And everybody was getting the flu on the team. And you look back 20 years ago, you go, well, no wonder why we're all drinking the same water bottle. And so, you know, we've just advanced in sport this far. And this is the same thing with COVID. So I know parents are frustrated, kids are frustrated. I think the light is coming, and the answer, quite frankly, is vaccines and vaccination. And what I talked about earlier about herd immunity and getting everyone vaccinated. We also don't know what the variants are going to do, and every part of the country is different and will likely open up at different times. But we will get back to sports, kids. And you know what? The weather's getting beautiful, except in Canmore tonight, where there's a snowstorm. But otherwise, you can still get out there and play outside. There's no reason we can't be outside having a great time. So
right on. Thank you. Thanks, Haley. Dr. Lafortune, we're going to go back to the last question and get it en français. What happens if I don't get my second COVID shot, and do I need this?
Oui, merci. Donc, la question, vraiment, je la répète en français. Donc, qu'est-ce qui m'arriverait si je ne prends pas ma 2e dose de vaccin, ou en aurais-je vraiment besoin? La réponse, c'est, donc, comme on l'a dit un peu, notre collègue nous l'avait parlé, Dr. Sedeb, on parle vraiment d'une immunité partielle. Puis par immunité, comme notre collègue nous l'avait très bien dit, On parle vraiment d'une immunité contre justement les hospitalisations et contre les décès, la mortalité. Donc oui, une dose nous protège bien, mais 2 doses nous protègent beaucoup mieux. Donc c'est sûr qu'on en aurait franchement besoin. Et pourquoi aussi, donc, on a parlé, Dr. Wickenheiser, on a parlé de l'immunité collective qu'on essaie d'atteindre au point de vue de notre communauté, soit entre 70 et 75% de notre population qu'on essaie d'avoir une immunisation. L'autre chose aussi, c'est pour retourner à une vie normale. Donc, possiblement, s'il y aurait un passeport de vaccination, il demanderait justement d'avoir une preuve écrite ou électronique d'avoir reçu 2 doses pour nous permettre de voyager, pour nous permettre d'être ensemble avec d'autres personnes, d'être dans des lieux de rassemblement, qu'ils soient sportifs ou communautaires, religieux. Alors, toutes ces raisons sont bonnes justement pour faire ce extra step, de faire ce saut et de faire confiance un peu à ce que la science nous dit en temps et lieu aujourd'hui et de toujours rester aux aguets sur ce qui s'en vient. Donc oui, les 2 doses sont importantes, on en a besoin, non pas seulement nous, mais collectivement.
Oh, merci. Dr. Sedev, when can we travel again?
So you can travel now. You can travel, but it's going to be complicated. When we say when can we travel again, I think probably what we really mean though is when can we travel again like we used to travel before. So it's not going to be all or nothing. It's not going to be we can't travel and the next day it goes back to being normal. Chances are travel to the US and other countries that have a high uptake of vaccination probably going to be open to travel to those countries by fall. People that I've had an opportunity to speak to say that the US-Canada border is probably going to be opening up a bit in the summertime, given that we're both making great progress, great inroads with vaccinations. That's very promising. But there's this other problem of hotspot countries, places like Brazil, India, et cetera. And it might take a while. We're looking at 2 to 3 years potentially for them to get their pandemic status under better control. And even if you're fully vaccinated, there's still going to be travel advisories against going there. There's probably going to be limited flights, limited access to those countries by means of travel infrastructure. And that's probably for good reason, because we know that when there's an abundance of infected people, an abundance of virus, those are the situations where you're going to have more likely a novel strain produced. Our epidemiologists, our public health people back home know that. So they're going to be very aggressive about making sure that Canadians don't go to those places. And if they do go, it's not going to be easy to get back. To just kind of slip past the visa line. Vaccine passports, this is very, 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 very likely, particularly for destination countries. You can imagine when a place in the Caribbean that has people congregating from all over the world for a week at a time and then going back to their respective places, that's a recipe for disaster if people are not vaccinated in this current age. Yet again, another reason to get both your shots done. If you want to travel again like you used to, the places that you probably want to go to are going to require it.
All right. Thanks, Dr. Sedev. Dr. Cora, I have kids under the age of 12 and over the age of 12. Will they have to get the vaccine to go to school?
So right now in Canada, the Pfizer vaccine is authorized for kids 12 and older. And I don't think we're going to have mandatory vaccines for school. However, we do know that more in-school transmission happens in that over 12 and over age group. And similarly, we're now seeing a mental health crisis in our children, especially our teenagers. And we're seeing a lot of loss of education and socialization that is happening, particularly in this age group. So whereas the vaccine is unlikely to be mandatory, being vaccinated will mean that these kids can return to do what they're supposed to do, go to school, hang out, make friends, discover that they want to save the world. There is a lot to protect in that age group.
Thanks, Dr. Cora. All right, so this is going to be our last question, and it's a bit of a group question. I want to ask all of you, there's a lot of talk about things returning back to normal and much speculation as to when this will be. We all know vaccinations are crucial to this being even a possibility. So, doctors, I want to ask each of you, what is the first thing you're going to do when things go back to whatever your normal is?
Hey, I will go first. I think I'm going to catch up on hugs and kisses. You know, I'm Latina. I hug and kiss, and yeah, so I need that.
I'm gonna give a full body guilt-free hug to my parents and to my best friend who lives across the country who really needs a big hug right now. And then afterwards, I'm gonna go back to the geekiest but my most enjoyable activity, which is ballroom dancing.
Nice.
I can't top that. But a couple things for sure is I haven't seen my mom in a long time. She's out in Calgary. If you're watching now, you know I love you, moms. I'll pick you up, squeeze you tight. You know, and the other things, I can't wait to hit my gym again and hit the ice. I know, Haley, you know what I'm feeling. I haven't played hockey in I don't know how long now, and I know it's beer league, but I miss the boys. I miss the intensity, and so that to me will be right up there.
Yeah, definitely icing and also supporting our teams. You know, it's summertime, playoff is starting, you know, Montreal against Toronto. So for sure, I'm looking forward for that. And maybe go to the Bell Center or to Air Canada Center in Toronto and, you know, cheers for the Habs. So that's my thing.
I'm a mom. I'm lucky. I get lots and lots of hugs from my 2 and 5-year-old boys, but they haven't hugged their grandparents since March of last year. And when the grandparents are fully vaccinated and they can give their grandsons a hug again, I'm going to be watching and probably, you know, shedding a few tears of happiness and joy for all of them. I can't wait for that.
So I'm a shift worker, and I cannot wait for my kids to be back in school and my wife to be back at work so I can take a damn nap after my shift. I'm really, really, really looking forward to some good sleep. But more particularly, you know, like everybody else, the grandparents want to see the grandkids, and we've been looking forward to that for a long, long time. And my little guy is a transportation aficionado, and this little guy is dying to go on a public bus or some kind of transit, and I want to get him back out to a point where we can take the bus to Grandma and Grandpa's house, and the smile will be ear to ear.
I just can't wait to hug people I haven't been able to hug. So just like everybody else, that's what I'm waiting for. And then after that, I'd love to attend a powwow where our people love to just be together, and there's lots of hugs and handshakes and socializing going on, and we miss that. So I'm anxious to get back to that.
And I'll have one serious and one fun. So in a serious note, I look forward to the day where the anxiety will melt away from my son, who is 21 and absolutely worried, sick about this pandemic and having a very difficult time with a mom who's in and out of hospitals. So that will be a joy. And the second thing, I'm going to just throw some shade. Montreal, Toronto coming up. Can't wait till there's a full Scotiabank Center or Bell Center of fans heckling each other, screaming and yelling, and be at a hockey game, back to the life as we all know it. So Clara, you know the big stage, and we're all looking forward to that big stage of life again, I think, as we've all are used to.
Well said, doctors. There you have it. This is our shot, Canada. We've come so far in this short period of time, and each of you has made a difference. We still have so much work to do for ourselves, our families, our communities, country, and the world. The toll of the pandemic is vast, and the longer it stretches out, the greater the damage will be on our health, our mental health, and our well-being. The mental health and addictions impact is said to be the coming pandemic, which is why This Is Our Shot from the very beginning wanted to make a significant difference for youth mental health. Proceeds from t-shirt sales are going to Kids Help Phone, Canada's only 24 hours a day, 7 days a week national service offering professional counseling, information, referrals, and volunteer-led text-based support for young people. I'd like to announce tonight that so far, these shirts have raised $83,000 for Kids Help Phone. Amazing. Thank you, doctors, for your time, for your caring and your service. You are all healthcare heroes, and we thank you. In the words of Bonnie Henry, stay calm, stay kind, and stay safe. And from us at This Is Our Shot, make an appointment, get your shot, encourage others to do the same, and keep up with all the public health recommendations. This is our shot, Canada. Let's keep this momentum going. Thank you, and good night. Good job, everyone.
Great job, Clara.
Good job. Thanks for sticking around.
Clara, you were awesome. That was fantastic.